Go back. Okay, hello, good afternoon. Thank you, Dr. Kenneth, for joining. I can see you there. Thank you, everyone. Welcome to Divinely Classic Health and Fitness. I'm really appreciative of you all joining. Thank you so much. Thank you. I'm not going to call names now. Thank you, everyone, for coming. Thank you for joining this event. Thank you for registering. It's one thing to do an event or plan an event and have people actually attend. So I do appreciate you all being here. A lot of you know me. My name is Eweka Osarabo Esangbedo. I am the face behind Divinely Classic, and Divinely Classic is a brand, an entrepreneurship brand, really, where we sell health and fitness products. We also do health education, and thank goodness you are part of this health education today. We encourage, or rather we empower the public with information that would benefit their health in terms of managing health conditions, in terms of preventing acute and chronic health condition. That's one of the things that we do. Also, we encourage healthy living on Facebook, on Instagram, on YouTube. We share our meal ideas just to encourage the public to live a healthier lifestyle, to make healthier choices in terms of our food, in terms of being active, not to live a sedentary lifestyle. So yeah, that is what Divinely Classic is all about. And today is one of our health education program. And the topic is prostate cancer. This month is the month of prostate cancer. We're trying to raise awareness to let people know, because that's one area that people don't talk about much. As a woman, I am a woman, and we have loads of resources out there for breast cancer, for other forms of female cancer. But in terms of men's cancer, I'm not saying there are no resources out there. There are resources, but it's not talked about as much as it should be. And we all have male relatives. We've got fathers, we've got husbands, and we've got children. The earlier we equip ourselves with this information, the better for and everybody involved, because God forbid if our relative is ill, it's going to affect us. On that note, we have a special guest in the house today. His name is Dr. Andrew Eweka. He's originally from Edo State, Nigeria. He lives here in the UK, and he is a practicing doctor. And he has decided to share with us some information about prostate cancer, about how to prevent, how to manage it. And, you know, we had a kind of a rehearsal last night, and he went like the full 12 years. He did the proper thing, like he was doing the dissertation. I remember telling him that, oh, this is a lot. So he's well equipped to teach us. And I would encourage us to please write questions down. If you have any question that you would like to ask, or any contribution, if you are a medical personnel in the house and you would like to add something, please feel free to add. Once again, thank you so much, everybody. And, you know, I'm glad that we're starting this time, and we're not going to waste too much time. We'll start, and if people want to join, they will join us. On that note, I will hand over to Dr. Eweka to introduce himself and crack on. Thank you very much. Dr. Eweka, can you unmute your mic and your video, please? Thank you very much.
Hello, everyone. Good afternoon. My name is Dr. Andrew Eweka. I'm a junior doctor here in the UK with over 5 years of experience. I graduated from the University of Benin, year 2017, and I'm practicing medicine, during which time I have gone through, I've worked in countries like Nigeria, Saudi Arabia, and I'm working in the UK at the moment. I really want to appreciate Mrs. Esangbedo for this opportunity to share my little knowledge about prostate cancer. And I feel it's a very, very timely one, because this month happens to be prostate cancer and ovarian cancer awareness month. So it's a very, very beautiful thing she's doing, helping to spread the word about chronic diseases as well as acute diseases and how to prevent it. going forward. So I really want to thank everyone that came here and showed up on time. Thank you very much. During the next 30 minutes, we'll be discussing about prostate cancer under the following heading. Can you see my screen?
Not yet.
A second. Can you see the screen? Okay, so we'll be going through prostate cancer in the following outline: introduction, epidemiology, the causes, signs and symptoms, the test and diagnosis, as well as the treatment. Then we'll be going through the meat of the matter, which is the prevention, which is the most important aspect of today's discussion. And we'll also be discussing the prognosis and concluding. Before we go into the topic of today, I want to encourage us to share our discussions through the chat box, because there's a chat box there. And if you want to privately message me, you can also do that, and we'll have a robust discussion. Questions will come up at the end, and I will encourage you to ask questions as well. So to start with, prostate cancer is becoming very important, an important kind of cancer to know about, because the incidence and the prevalence of prostate cancer is increasing as the day goes by. So before we move on to what prostate cancer is, let us look at what the prostate is to start with. So the prostate is a small gland that is part of the male reproductive system. It's really small because it's the size of a walnut. You know what walnut is? It's quite small. And it sits below the urinary bladder. The bladder is the organ that helps to hold urine in all animals. So it's just below the bladder, and it surrounds the urethra. The urethra is like a pipe that brings urine from the bladder down to the penis of the female urethra for voiding. So it actually carries urine and semen out of the body of a male. So what does this prostate gland do for men? What it does is that it just produces the fluid part of semen, which is emitted during ejaculation, okay, as part of the male sexual relations. So what the prostatic fluid does is that it helps to keep or to make that semen alkaline. So what does this alkalinity of the semen do? It helps to neutralize the acidity of the vaginal tract, okay, so that the semen will still be viable to prolong the lifespan of the sperm. So that's what the part of the seminal fluid that is produced by the prostate does for the sperm. So having looked at the function, we'll move on to other aspects of the prostate. So apart from the fact that prostate helps in reproduction, forming part of the sperm, it also helps to regulate urine flow, okay, because it's around the urethra. So it releases the urine from the bladder as well. So that is why when you have prostate issues, you have some signs and symptoms of urinary problems associated with it. Okay, it will also surprise us to note that in all adult males, the prostate increases in size as a man begins to age. So you cannot compare the size of a prostate of a 20-year-old to the size of a prostate of a 60-year-old. Obviously, the 60-year-old will have a bigger prostate than the 20-year-old because the 60-year-old is obviously older. So that means prostate increases in size as a man begins to get older. All right. So now coming to prostate cancer. What is cancer to start with? Okay, cancer is a process or a condition where the cells in the body divide abnormally. Okay, they begin to proliferate in ways they're not supposed to proliferate. They become disorganized in their growth patterns compared to how a normal cell is supposed to divide. So when cells begin to divide, let me use the word anyhow, okay, cancer begins to form and begins to spread and get worse. There are different stages of cancer, stage 1, stage 2, stage 3. When you say stage 1, it means that the cancer is still within the gland or the organ in which the origin is from. Okay, when you say stage 4, stage 5, that means it has already spread to other parts of the body, probably the bone, other organs, or lymph nodes, as the case may be. So that is what cancer is briefly. There are different kinds of cancer in the body. You must have heard of lung cancer, liver cancer, stomach cancer. There's a whole lot of cancer these days. But prostate cancer is quite important because it's the number 2 most common type of cancer for men worldwide. I think at the moment, I think skin cancer tops the list. We have prostate cancer, we also have lung cancer, and so on and so forth. So it's getting popular as the day goes by. So I think it's important for us to dive into it and know more about it. Okay, so there are different things that can happen to the prostate of a man. There's something we call benign prostatic hyperplasia. That's when the cells get inflamed and they proliferate excessively. Okay, but that is not prostate cancer. That's different from prostate cancer. Okay, in benign prostatic hyperplasia, the cells are just proliferating rapidly. Doesn't mean that they are cancerous or they have cancer. Okay, we have men who have what we call BPH, which is the benign prostatic hyperplasia, but that's not prostate cancer. I just want to differentiate between both of them. Okay, someone has BP, don't know that the person has prostate cancer. They are two different entities entirely. Okay, so women or men who become trans, like a man who becomes a trans woman, maybe changes his sex. Okay, most times they don't have what we call complete genital reconstructive surgery, meaning the prostate is not removed. So these people are still prone to prostate cancer. That's why the fact that they are now trans women. Okay, and so these are the people that are prone to prostate cancer: men, trans women, non-binary people, people who don't identify either as a male or a woman, and some intersex people that were born both as male and female, which is a hermaphrodite individuals. So those people are all prone to prostate cancer because they have a prostate. So now let's go to the epidemiology. The truth of the matter is that prostate cancer can happen to all men, okay, as long as you are male. But however, it is very rare below the age of 50 years. As a matter of fact, about 99% of prostate cancer cases occur, okay, after the age of 50 years. So what this epidemiology is that we're just trying to look at the determinants, okay, the deterrents and the distribution of this prostate cancer. Where does it occur more? Okay, I don't want to dive too much into it, but one thing you must know is that Black men are more prone to prostate cancer than white people, okay, for reasons unknown to us, because there's still some just genetic predisposition that is being postulated that might be the reason why Black people are more prone to prostate cancer than white people, okay, because research has been done already. Also, older men are more prone to younger men in having prostate cancer. I've mentioned that before. Also, family history is very, very, very important, because a man who has a relative, a first-degree relative who has prostate cancer is 2 to 3 times likely to develop prostate cancer in the future. This one is very, very, very important as well. So I'll try to summarize the conversation so that we will not spend too much time here. Okay. So now this slide is talking about the causes of prostate cancer. What might predispose one to prostate cancer, or what might cause prostate cancer? In the world of medicine, we have what we call modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are the things that you can change when it comes to causative factors, but the non-modifiable are the things that you cannot change. For example, you cannot change your age, okay? You cannot change where you come from. You cannot change the fact that you're a man, okay? You cannot change the family that you were born from. So those things are non-modifiable. So there's nothing you can do about it. You're just prone to it, okay, because of those identifiables. While the non-modifiable are the things that, of course, you can change or you could modify on your own part. So top on the list for causes of prostate cancer is obesity. All right, obesity is when your BMI, or your body mass index. This is when you divide your weight, weight divided by the square of your height. Okay, that's what we call body mass index. Okay, when it's above 30, you can say the person is tilting towards obesity. Okay, so obesity is, in layman term, you are fat. Okay, that predisposes, okay, you to prostate cancer as a risk factor. Okay, so there are other risk factors that have been identified, but I didn't mention them in the slide because they've not been fully recognized as risk factors. They are not in the books yet, in literature, but they are still undergoing research. Okay, of course, things like smoking, high alcohol consumption, like your diet, you know, when you take too much trans fat or saturated fat, it can also predispose you to prostate cancer, just like any other kind of cancer as well. Okay, so even red meat is another risk factor that is still undergoing research even now. Okay, so we'll look at those risk factors in the prevention when we get there. Okay, so now that we have looked at the causes, let's go to the symptoms and signs of prostate cancer. How do you know, or how can you suspect that somebody is manifesting the symptoms and signs of prostate cancer? These are the issues. So we'll be discussing it in a second. Okay, so top on the list is difficulty in urination. The patient or the man might complain of a weak or problem with urinating, a weak flow of urine, or pain, or the burning sensation when he urinates. He might also complain of frequency in urination. If the man needs to go to toilet maybe 5 to 6 times every day, he begins to urinate up to 10 times every now and then. Even urination wakes him up at night, something we call nocturia, frequent nighttime disturbances. Okay, some of them might even urinate on themselves if it gets worse. So some of them might exhibit this training to urinate when they have to use or apply force for the urination or the urine to actually pop out. So these are all difficulties encountered in urination. That's number one, signs and symptoms of prostate cancer. Also, they might find blood in their urine as the disease progresses. And in some men, because of the fact that prostate is very important in erection, you might have erectile dysfunction, okay, like difficulty in maintaining an erection. And when the disease begins to spread, they might have pain or discomfort in pelvic area, the lower backs and the hips and even the thighs. And of course, just like any other cancer, when it has spread far and wide, it has caused a lot of problems, affected the lungs and other parts, might lead to loss of appetite and weight loss because of the drop in the blood levels. That can also cause fatigue and weakness. Okay, so now we have looked at the symptoms and signs. We will look at the tests. How do we test for prostate cancer? There are different tests that are done. There's a screening test known as the PSA. What does PSA stand for? Is what we call prostate specific antigen. Okay, it's actually a protein that is produced by the prostate gland. Usually, when there is a cancer going on, we find out that this PSA level is elevated. But the truth of the matter is that this screening test called PSA is not very, very accurate, or it's not very sensitive. Let's put it that way, because the PSA can be secreted by the prostate gland, even in several other conditions apart from prostate cancer. So let's say there's an inflammation of the prostate gland now, probably the BPH I mentioned before, where there's a rapid proliferation of the prostate gland, the PSA will be increased. So for the fact that a PSA is increased doesn't mean that somebody has prostate cancer automatically. So the reason I'm saying this now is that I've seen a lot of persons giving me calls from Nigeria and say, my uncle went to do PSA while the PSA was high, so and so value. It doesn't mean he has prostate cancer. That does not mean he has prostate cancer. It's just a screening test. Okay, it's just like, for example, you go and do a sugar level, glucose level, and it's high. You will not just conclude that you have diabetes like that. You need to follow it up and do further confirmatory tests as well. So the other thing that can also increase PSA level like for example, a man just ejaculates, okay, 5 minutes ago, 10 minutes ago, the PSA level would be elevated immediately, okay? Let's say somebody had an injury to the perineal area or the rectum, the PSA will be increased as well. There's something I'm about to mention, something we call digital rectal examination, where you put someone's hand in or someone puts his hand in your anus to examine the prostate gland. After that procedure, the PSA will also be increased. So you can see that there are different reasons why PSA will be increased. But the truth of the matter is that PSA will just give us an idea or point us to the fact that there might be prostate cancer occurring. So that will now make us to now investigate further or do further tests as medical practitioners. I hope I'm not speaking too much jargon on that. Okay, so PSA is just like a pointer, a screening test to give us an idea. So if the PSA is increased, there are further tests we can do in the clinic or in the hospital to confirm if a person has prostate cancer. Usually, most times, the urologist, who is a specialist in such conditions, will offer the patient an MRI scan just to localize the cancer and to see if there are any changes in the prostate gland. And if that is the case, the patient will undergo what we call a biopsy. It's the biopsy that is the main diagnostic test for prostate cancer. It's a test where tissues are taken from the prostate gland and sent to the lab, okay? And the tissues are examined under the microscope to see if there are actually any cells that are cancerous. That is what when it comes to diagnosis. Biopsy has to be done before we confirm the person has prostate cancer. Okay, so even before the biopsy is done, the doctor will have to do what we call a digital rectal examination. That will involve the doctor putting a lubricated finger into the back passage of the patient just to feel the prostate, to feel that, okay, the prostate is irregular or hard or has some cancerous changes before further tests are done. So that is what is done, just a sneak peek of what we do in the clinic. So another problem with the PSA test is that 3 in 4 men who have elevated PSA will not go on to have cancer. So it means that 75% of men who have elevated PSA do not end up having cancer. And also 1 in 7 of men who have normal PSA may have prostate cancer. You can see that the test is like this. It's not really so straightforward as far giving us information about what is actually the issues. So we move on to the treatment. What kind of treatments are available for prostate cancer? I will just summarize this part. I won't dive too deep. Okay, so the possible treatments include watchful waiting. Okay, when do we do watchful waiting? We do watchful waiting when probably the man is very old and we know that the cancer will not really affect the natural lifespan. Just as the name implies, watchful waiting, just waiting to see how the natural course is supposed to go. So we're not intervening, we're not doing any investigation, we're not doing any intervention, we just observe the patient. So we usually do this for very older men. Let's say a man presents and it's like 95 years old. What else is he doing on air? Like what can you really do for him to help or improve his well-being? So at that point, you just do watchful waiting and see how it goes. Okay, sometimes when I say a patient presents very, very, very in the course of the whole thing, let's say in the very, very early stage, you don't want to do anything at that point. It's not that time you start removing the prostate. So you just do watchful waiting and what we call active surveillance. You are doing tests and following it up every 6 months, every 1 year. Okay, doing PSA tests, doing biopsy just to see if the cancer is changing, because there are different types of prostate cancer. There's a very, 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 very malignant one that goes far and wide. There's some that are very, very calm, quiescent, they just remain where they are. So we need to know what it is, and so that we will not give you inappropriate or irrelevant treatment. So that's the essence of watchful waiting and active surveillance. It's not everybody that undergoes this, depending on the type, the stage, and the type of patient that we are dealing with. So we also have another treatment called the radical prostatectomy. It's just a surgical removal of the prostate gland. Okay, so it's usually done for the cancers that have not spread far. It's just like a normal surgery where the prostate gland is removed. There are different routes that you can use. You could use the pubic area, you could use the perineal area as well to remove the prostate gland. So the risk involved in this surgery, just like any surgery, it can be bleeding, it can be infection. Also, people who have these surgeries might have erectile dysfunction and going forward, urinary problem. They're not able to control their urine later on. So the advantages and disadvantages, I don't go into it, that's not our business. Okay, we also have radiotherapy, where we use radiation to kill cancerous cells. And that is usually done in the outpatient, not in the hospital. You don't need to be admitted for this to happen. There are some patients in the UK that do radiotherapy instead of surgery for treatment of prostate cancer. Okay, it also has a side effect as well. Okay, there's also hormone therapy, where you give hormones like testosterone to treat the prostate cancer. There's also what we call.
Excuse me, please.
Sorry. Okay, we also have what we call high intensity focused ultrasound, where the ultrasound probe is put through the rectum, uses high frequency sound waves to kill the cancer cells. There's also what we call cryotherapy, where the cancer cells are frozen, okay, through cryo needles. We use cryo needles to freeze the cancer cell to kill it. So each of them have their advantages and disadvantages depending on what the patient wants and what the specialist deems fit for the patient to have. Okay. So when the cancer has spread far, usually we offer chemotherapy. This is offering medications, okay, to kill the cancer cells. They can't cure the cancer, but just helps to control the cancer to help the patient live longer. All right. So this is the main issue for today: prevention of prostate cancer. Now that I've discussed about the signs and symptoms and the treatment, we'll be looking at the prevention. How can you prevent prostate cancer? To be very honest, there's no preventive tactics in the literature at the moment. But however, these are all postulations based on the researches that are still ongoing. Okay. For example, they're talking about improving your diet. I mentioned before that reducing fat intake can go a long way in preventing prostate cancer, because if you eat less trans fat and saturated fat, it will reduce the likelihood of formation of prostate cancer going forward. So food like fish, nuts, seeds, okay, and omega-3 fatty acids containing food are better off than trans fat and saturated fat, like the ones you have in butter, red oil, and all that stuff. So it has also been suggested that high calcium intake, like the one you find in milk, and when you take it too much, it might be linked to advanced prostate cancer. Still under research, but it's something we need to take note of. Okay, so in terms of diet now, we have found out, I think this one is confirmed, that cruciferous vegetables, for example, vegetables like broccoli and cabbage, okay, contain a compound known as sulforaphane. So this helps to protect against cancer. Okay, I know we have broccoli here in the UK, but no, I'm not sure we have broccoli in Nigeria, but we have cabbage in Nigeria. We use it for salad and all that. So those are cruciferous vegetables that are quite helpful in containing prostate cancer. Also, there's an idea or hypothesis that says that lycopene is an antioxidant present in tomatoes that has been shown in some studies to slow the growth of prostate cancer cells. So that's also very important. Lycopene in tomatoes, and also leafy grains, leafy vegetables are also we also encouraged to take more of that. Okay. So generally, any food that contains antioxidants is really good for cancer prevention. Okay, so moving on, now we spoke about diets. Look at maintaining a healthy weight. We mentioned before that obesity is a risk factor for developing aggressive prostate cancer. We could maintain our weight by, of course, using weight, exercising, shredding weight. Usually we recommend 30 minutes of moderate aerobic exercises every day for at least 5 days in a week. I know it's easier said than done. I know it's easy for you to say, okay, oh, exercise, but it's not really easy to inculcate it into our lifestyle because of the kind of life most of us live. We all work, we all school, and we are always very busy. But then it's the onus lies on us to be able to be intentional about these things. For example, personally, I don't even jog every day, to be honest with you. But I try to be intentional. What do I mean? Instead of using the elevators, I try to use the stairs every now and then. So moving around, helps me. I end up spending more than 30 minutes trekking every day. Okay, so that will also be very good. Instead of driving your car to the next shop to get something, why don't you just walk there? Okay. All right, so if you own a treadmill at home, that can also come in very handy for exercising. Okay, so maintaining a healthy weight is quite important for prevention of prostate cancer. So having said that, smoking, okay, and drinking, stop smoking and drinking less is it's a proven way of improving our health in so many ways. Not just in reducing the cancer risk, but improving our health. Because these are also risk factors for other serious problems in the body. I don't want to go into that in detail. So if you smoke, stop smoking. If you drink alcohol, drink less, reduce the amount of alcohol you consume on a daily basis. Okay. So this one is quite interesting. Staying sexually active. Okay, there are some studies that are done show that men who ejaculate more frequently are less likely to be diagnosed with prostate cancer. The studies are still ongoing, but 2 studies have confirmed this assertion that staying sexually active is quite important in prevention of prostate cancer. So this goes to the men for us to take note of. Thank you. So what's the prognosis of prostate cancer? We would like to say that it depends on where you are, what parts of the world you are. There's some very low, undeveloped areas, and there's some quite developed areas. So depending on the diagnostic tests that are available, the kind of specialists that you are involved with, and depending on the time frame in which your cancer is diagnosed, that goes a long way in determining how well the condition can be managed and the prognosis thereof. So early cancer detection is always very paramount and key to survival on the long run. Okay, so yeah, so in conclusion, prostate cancer is a quite common cancer in men, and it can be prevented by having a healthy lifestyle, eating the right diet, okay, reducing your weight, so stopping smoking, reducing the amount of alcohol you drink, as well as using other risk factors that can be modified. And going forward, it's my prayer that none of us have anyone that has prostate cancer, and those who have prostate cancer, we have a long lifespan and be treated appropriately. So thank you very much. That brings that's the end of this presentation. So I'll be asking some questions, and just to see if you guys have been following. Okay, so I'll be asking some true and false questions. All right, and if you know the answers to any of these questions, just probably vocalize it. Moderator.
Hello, moderator is here.
Okay, I don't know how do we answer this question. We just
I would suggest you could just put it in the chat section, or if you want to unmute yourself and speak up, but then a lot of people will be speaking at the same time. So just put it in the chat section, what you think, and then after maybe some answers, you can tell us what the right answer is.
Okay, they're quite simple questions anyway, just for us to recap what has been said already. Okay, so we'll be using the chat box for the answer. Do we know how to use our chat box? Okay, so yeah, you can see the first question. The first question is men of any age can get prostate cancer, true or false?
Let's just type in the comment section or the chat box if you think it's true, if you think it's false. And this is just kind of to reinforce the message, a test of what we've learned today. So please, let's make it interactive. And what do you think? Is it true or false? Okay, somebody said false. Oh, somebody said true. We have a true. True, but mostly above 50. True. False. True. So we have more true than false. True. Okay, so we have true, true. Everybody's saying true. Just one person said true, but mostly above 50. True over 50. Yeah. So what's your answer, doctor?
Well,
thank you everyone for the messages. Thank you.
Thank you very much. It was many people answered this question. So the answer to this question is true. As I said before, prostate cancer can happen to all men. In fact, it has been reported in literature that I think a 29-year-old man had prostate cancer in the past, but it's more common in men over 50. Okay, 99% of prostate cancer occur in men above the age of 60 years old. So it's more common in elderly men, but however, it can occur in all men. Okay, so second question is prostate cancer often causes men to have trouble passing urine. This question is a very tricky one.
Okay. Can we put our answers in the chat box, please? True or false? Thank you. True. 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 True, it's one of the listed symptoms. True, true. So we have a lot of truths. True. Okay. Any more answer? If there is none, you can tell us the answer, doctor. Somebody said true, little or no urine.
The thing is, this question is quite very controversial. But the fact is, for most men that have prostate cancer, they have no symptoms. Yeah, it's in the literature, and it's been proven that they have no symptoms at all. So I would say false for this question. Is when it becomes more advanced, that's when we begin to have this trouble passing urine, okay, as it were.
All right, can I ask a question, doctor? When you say trouble passing urine, is it that there will be limited urine, or the person just can't pass urine? Because that could be symptoms of other health issues, if I'm correct, sir.
Yeah, you're very correct. The truth is, trouble passing urine can be in different forms. There might be difficulty passing urine. Okay, there might be what we call urine retention, where the patient cannot pass urine. Okay, for hours, days, weeks. Okay, there can also be pain in passing urine. Okay, what we call dysuria. Person is having burning sensation. Okay, that might also happen in other conditions apart from prostate cancer. For example, if someone has an infection of the urinary tract, that what we call UTI, there might be dysuria. So what I'm trying to say is that it's not every time someone has a sign and symptom that I mentioned here today that you just say the person has prostate cancer. If a person has these signs and symptoms, that calls for further investigation by the medical practitioner, because it might just mimic other conditions. For example, someone has diabetes. In diabetes, we find out that the patient urinates more often than not, something we call frequency, which was even mentioned in the slide. Okay, so these are signs and symptoms that are shared with other conditions as well. Okay, so it doesn't just mean that okay, somebody has blood in the urine, you just conclude that the person has prostate cancer. That patient might just have a kidney problem. Okay, it might have a kidney problem. So having said that, I think we've answered that question, but I'm not sure the question was phrased properly. I would have said most prostate cancer, most men with prostate cancer have trouble passing urine. That would have been false. But the way this question is now, I think true is the correct answer. So I will give it to the audience. Thank you very much. We move.
Thank you.
So the third question is, prostate cancer always needs to be treated right away.
Thank you so much, Dr. Ken. I say I have to go now. Well done for your great work. Thank you so much. Thank you. If you don't, okay, I will. Thank you. Sorry, it's just a message I was reading out. Thank you. Carry on.
Prostate cancer always needs to be treated right away. True or false?
Okay, that's another question now. Prostate cancer needs to be treated right away. True or false? You're saying false? False? Go false in there. Let's get your answers, please. True or false? Okay, true when diagnosed. False. True from, okay. True. True, okay. Somebody said cancer has no cure. It can be managed. Thank you for that. Okay. Early detection is key. Thank you. So true or false? What do you think? And it needs to be treated right away? True or false?
Okay. The treatment of prostate cancer is highly encouraged, but what makes this option false is because of the always that I wrote there. Okay, I mentioned in the slide that we have what we call active surveillance and what we call watchful waiting. Okay, the treatment of prostate cancer depends on a whole lot of factors. Okay, it depends on the age of the patient, it depends on comorbidities, what kind of other medical conditions that the patient have. Okay, the stage of the cancer, how far the cancer progressed. Okay, and also the type of cancer, what type of cancer is it? Okay, I don't want to go deep into it, but however, that would determine the kind of treatment we give. Some of these patients, we just leave them, we just keep monitoring them to see how they progress. So it's not in all cases you just treat right. Some of them you have to just monitor and see how it goes. So the answer to that question is false. The fourth question is all men should be tested for prostate cancer.
Or false? All men should be tested for prostate cancer. Can we have your answers, please? True or false? Somebody said true. All men, okay, true. False, above 50 years, yes. True. Read the question properly. Okay. True, okay. So all men should be tested for prostate cancer. Somebody said true. Early detection is key. Okay, any more answers? Somebody said false, because the question is very tricky if you don't read it properly. Because when we're talking about men now, you're talking about adults, doctor, if I'm correct, from 18 to 80 or 90, right?
Yeah, all men.
All men. So read the question. Somebody said false. Yeah, there's no more answer now. Okay, somebody said true, 40 years and above. And let me go to Facebook. I'm actually having some comments from Facebook. Some people are watching from Facebook. Okay. Some said true, some said false. So what would the answer be, doctor?
Okay, I mentioned before in the slide that we have what we call the screening test for prostate cancer. Okay, yes. screening test is what is done when the patient does not have signs and symptoms, but you're just trying to catch it in the early phase and prefer a solution. Okay, so that's what we call the screening test. But the truth of the matter is that not all men benefit from this screening test, owing to the fact that it is not very sensitive and it's not very specific. Because for the fact that somebody has a high PSA does not mean that person has prostate cancer. I mentioned before that 3 in 4 people with high PSA don't go on to have prostate cancer, and 1 in 7 of people with normal PSA will be eventually diagnosed of prostate cancer. So in most countries across the world, even here in the UK, there's nothing like a prostate cancer screening program. It's what we call, there's something we call informed choice screening. That means if you're above the age of 50, you can decide to work with the doctor and do a PSA test. It's not advocated by law that, okay, you must do a PSA test. It depends on the risk factor that is available or that is prevalent in the patient. For example, let's say somebody has a family history of prostate cancer. Let's say the father had prostate cancer in the past, and the person is above the age of 50. We as also will encourage the person to have prostate screening. But if someone has, let's say someone is 40 years old and has no risk factors, okay, and the person has no risk factor available for this prostate cancer, there won't be any need for screening. And the patient has no signs and symptoms, there won't be any need for screening. Okay, because if you detect the high PSA, the patient might just undergo unnecessary investigations eventually. Okay, so that is what is obtainable now. So not all men should be tested for prostate cancer, depending on the risk factors of the patient and the age as well. So that answer is false. So finally, you have the last question so that we'll end this session. There's nothing that can be done to lower your chances of getting prostate cancer. True or false?
Okay, let's comment, please. True or false? There's nothing that can be done to lower your chances of getting prostate cancer. Do you agree or do you disagree? True or false? Somebody said false. 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 Yes, we have loads of false. Oh, the false is coming with passion. False. So majority are saying it's false. False. Thank you all so much for your contribution.
So much. I really appreciate it. So this last question, the answer is false. Obviously, we already know that there are things we can do to prevent prostate cancer, which I mentioned in the presentation. Okay, I'll just recap. Number 1, eating healthy diets. I mentioned the reduction of very, very harmful fats like trans fatty acids, saturated fats. If you Google it and find out the sources of this kind of fats and avoid it if you're a male. Okay. Also, eating healthy diets, eating a diet containing lycopene, like tomatoes, eating cruciferous vegetables like cabbage, like broccoli. Those contain substances that have been proven to prevent prostate cancer. Also, having a healthy exercise regimen that will help to prevent overweight or obesity will come in very handy in prevention, as well as stopping smoking, reducing alcohol, and having a balance or staying sexually active. So these are preventive methods that we Thank you very much. I think with that, we come to the end of this discussion. The floor is open for questions and discussions that might arise. Thank you.
Thank you very much, Dr. Eweka. I really appreciate you. Thank you so much for your time. Somebody's raised their hands up already. Thank you. Thank you for the applause as well. We do appreciate you. And if you can see, he's got 64 slides to tell you how prepared he came. So I do appreciate your time. Orti Brida, she raised her hand. She has a question. Do you want to unmute your mic, please?
Yes, good evening, ma. Good evening, everybody.
Thank you.
Doctor, please, I want to ask the kind of food that contains, you said something like omega-6, Abi. So I want to know what kind of food can contain omega-6.
Okay. Should I answer should I answer it now? Or do we have
Yes,
more?
please, you can answer. If not, we'll have too much. So we'll go through the questions because she's said we have loads of questions in the chat. So you answer this and then we'll take the questions as they come on the chat. And I do have some questions as well. Thank you, Doctor. If you answer her, please.
Okay. There are lots of sources of omega-3 fatty acids available in the market, provision shops, and all sorts of food shops. Chief on the list are food like fish, okay, fish and other kind of seafood, okay, salmon, mackerel, tuna, sardine, any kind of fresh fish you can get. Most of them contain omega-3 fatty acid. Also, there are different types of oil available in the market. There's what we call animal oil. We have plant oil. Plant oil are the types like what we call, there's a type I saw in the market, which the sunflower oil, sunflower oil, stuff like soya bean oil, okay, canola oil, stuff like that. So those contain a lot of omega-3 fatty acid. Even food like nuts, all these nuts, groundnuts, walnuts, stuff like that, contain a lot of omega-3 fatty acid. There are some kind of fortified food that they put omega-3 acid, they infuse it in it. For example, there are some kind of milk that contain omega-3 fatty acid, just for you to be able to look at the constituents of what you are buying and the content of this food. So there are lots of food that are rich in omega-3 fatty acid. Even liver has lots of fatty acid like that. So yeah, I hope that answers the question.
Are you satisfied with the answer? She's still mute. Okay, thank you so much. And Doctor, so we have some questions in the chat section. And if you want to ask a question, you don't want to put it in the chat section, you want to put your hands up and speak, that's good as well. So I will start with the first question. There are loads of applause for you and appreciating you. Thank you for the information. The first question says, frequent ejaculation should be elaborated on. Does this include masturbation? I'll use the word, because there are energy lost to the process. That's the male thing. If you want to throw more light on that, please.
Okay. Ejaculation can be in different ways, okay? There can be a natural process whereby a man meets a woman and after sex, or during the process of sex, the man ejaculates. A man can also ejaculate for masturbation. But I think the bottom line here is that these are postulations or theories that are still being worked upon. They are still being developed, even now that we are speaking. You understand? I mean, there are some books you will open, you will not even see frequent ejaculation as one of the preventive methods. But however, it's still undergoing research. But some research has been done, some past research has been done that have confirmed this. There are frequent ejaculation, because as I explained in my slides, if removing some of these toxins or carcinogens, as the case may be, that are involved with developing prostate cancer. So whether you do masturbation or what's it called now, you ejaculate naturally, the chances that you would have prostate cancer is actually lower than someone who doesn't ejaculate at all or doesn't have enough sexual relations. Okay, so that is what has been found in some quarters, but globally or universally, it has not been embraced holistically. So that's what it is.
Thank you very much. And that question leads to the next question, which is, he said, you mentioned frequent sex can help reduce the chance of prostate cancer. The person said, I had an uncle who was sexually active till 70, but still had complications. How do we explain that, please?
Okay, so sorry about your uncle who had the prostate cancer. I'm sure that must have been very terrible for him to deal with. It's not something that is a wish upon anybody. I just said that the prostate cancer has lots of risk factors, meaning every factor must not be present for that prostate cancer to develop. Okay. Probably he had a family history of prostate cancer. Okay. Even age puts him at risk of prostate cancer. The fact that he is Black puts him at risk of prostate cancer as well. We don't know how his diet was while he was still alive. Okay. We don't know how frequently he exercised. We don't know how far he modified his risk factors and all that. So my point is, having frequent sex alone does not just reduce your chances of prostate cancer to the barest minimum, but it's a factor that has to be explored. I said before, it's still undergoing research, and probably in the next 5 to 10 years time, there will be more robust research done that will give us more information about this subject matter. Okay, but the bottom line is there are different risk factors that can predispose one to that cancer, apart from this lack of sex. Yeah, thanks.
Thank you so much. I hope that answered the question. Another question said, is there possibility of developing this cancer from hazardous environment or substance? Because like lung cancer, if you work in some area, you're more prone to it, whether you are genetically predisposed or not. Is that the same for prostate cancer?
Thank you very much. Indeed, the environment plays a very huge part in the development of some certain cancers in the body. Just like you said in the example, okay, that some kind of dust found in some company, for example, someone who works in a silica company or probably asbestos company can be prone to lung cancer because they're exposed to that. Someone who works in the textile industry, okay, because of the is it benzene they call it, or naphthalene that is present in those plastic products, can lead to bladder cancer. But for prostate cancer, I don't think there's any environmental carcinogen or hazardous substance that has been linked to this prostate cancer yet. However, research is still going on, and hopefully more and more information will come out. But for hazardous substance, I have not come across anyone just yet.
Thank you very much. And then somebody said, I didn't join on time. Please, what are the symptoms? Just quickly recap, just briefly, please. Thank you.
Yes, thank you very much for that question. Okay. So the symptoms and signs of the prostate cancer includes difficulty in urination, whereby the patient might have pain in urination, inability to urinate. There are difficulties when you have to strain to urinate because of the mass effect of the enlarged prostate gland. Okay, some other times the patient might have blood in urine. Okay, sometimes there might be frequency when there's increased frequency in urination, more than the average number of times that the patient is expected to urinate on a daily basis. Okay, sometimes when the cancer has spread to other parts of the body, it might lead to pain, okay, in the back, lower back pain, in the hips, even the buttocks, even in the lower limbs as well. And sometimes there might be, just like any other cancer, there might be fatigue, tiredness, weakness. Okay, there might also be loss of appetite, weight loss associated with this. In some cases, there might be erectile dysfunction. Okay, so those are the symptoms of prostate cancer that are available in literature.
Thank you very much. I hope that's answered the question. I do have some questions. I've just written other people's own for that, but let me quickly do this. Another question from the chat box said, can Kegel exercise be of any help? And for those that don't know what that exercise is, for women, we are encouraged to do that exercise for improved bladder control. And, so is that the same for men? And does it help in this reducing the risk of prostate cancer?
Okay, this is a question that I would say for Kegel exercise, what it does is that it just helps to strengthen the pelvic floor muscles. Okay, and it's one of the treatment options that are recommended for patients with incontinence, okay, people that are not able to control their urine flow, okay. There are different kinds of incontinence. There's stress incontinence, there's overflow incontinence, okay. People cannot control their urine flow. It helps them a whole lot because it helps to tense and strengthen those muscles and pelvic floor that help or that are involved in urination. But as per reducing the risk of prostate cancer, no study has been able to confirm that, but it does help in even improving erection for men. To be very honest, it helps in improving erection for men. One of the exercises that is recommended by physiotherapists and even urologists worldwide. It helps in improving erection for men, okay, and reducing premature ejaculation. It helps in men, it helps in women, in reducing incontinence for women. You control your bladder more. Well, in prevention of prostate cancer, to be very honest, this exercise has not been proven to have any effect on it.
Thank you very much. We have somebody who's raised their hand. Hope Oludayo, can you unmute your mic, please? Thank you.
Yeah, good evening, everyone, and thanks again for the information, Dr. Eweka. Very educating, and then thanks, Divinely Classic, for presenting this to us. My question is around the, I think, preventative area. You mentioned that there are some particular substances that are found in broccoli and cabbage. I didn't get what the exact name is, that it helps to prevent prostate cancer. I think my question is just, is it unique to prostate cancer or does it prevent other cancers?
Okay. Yeah, thank you very much for the question. I just took the slide back to the part where I mentioned the chemical substance present. It's called sulforaphane.
Okay.
Yes. So sulforaphane actually helps in the prevention of most cancers, to be honest. It's not just prostate cancer, okay? So this sulforaphane is found in cabbage and broccoli. Those are the two common foods where you find this sulforaphane, okay? So it's all cancer, not just prostate cancer. There are still studies that are even going on that says stuff like garlic and ginger, help with this prostate cancer, but it's still going on, and very soon we'll get more information.
Thank you so much for that. Thank you.
Thank you very much for the answer. So one question that I want to ask is about examination. As women, we are encouraged to, they actually teach us how to examine our breast for lumps and stuff like that. Is that the same for men? You did mention PRO exam and that's perectum. Is that something that people can do in the comfort of their homes to like check if there are lumps for prostate cancer?
The way God created this world, life is not fair because women can actually examine their breasts from time to time, okay? And then it's actually advocated that self-breast examination helps a lot, okay, apart from the clinical breast examination that is done in the clinic or whatever. So women can examine their breasts to feel for lumps and any changes that they can see, obviously. But for this, there's something like self-prostate examination. Okay, because the digital rectal examination that is done by medical professionals is a very, very sensitive and a very, very delicate and detailed exam. Meaning just not anybody can just put their fingers into the rectum and feel where the prostate is and feel the changes in the prostate. It's very, very technical exam. There are even some doctors who find it difficult to even feel for the prostate and see where those glands are, okay, and see if the prostate is irregular or hard or has some changes. Talk more of a patient. Okay, so it's not one of the things that is advocated because it's preferred for medical practitioners to carry that examination out and find out if there are any particular changes. So it's not done in routine practice. It's not done. Yeah. Thank you.
Thank you very much. Another question. Can you just throw more light on, because sometimes we might get confused with enlarged prostate prostatitis, if I've said that correctly, and prostate cancer. So can you just differentiate between the three types of prostate conditions, please? Thank you.
Thank you very much. Thank you so much. Those three conditions you just mentioned are quite different from each other, but some people tend to mistake one from another. Okay. Prostatitis. What does prostatitis mean? It's actually inflammation. Just like anywhere you see itis in the body, it means inflammation. What does inflammation mean? It's just swelling of a gland. Okay. For prostatitis, usually it's caused by virus and bacteria. Okay, so that will lead to inflammation of the prostate gland. Okay, just like conjunctivitis, where you have inflammation of the conjunctiva. Which other one would like, for example, hepatitis, where you have inflammation of the liver gland. Prostatitis is inflammation of the prostate. Okay, so there are two types of prostatitis, where you have chronic one and the acute one. The chronic one is the more common one. So this prostatitis can be treated by, most times they use antibiotics. Sometimes you just use paracetamol and ibuprofen. Patient is okay. Okay, so that is it. It's just caused by bacteria most times that enter into the prostate through the urinary tract. That's for prostatitis. Okay, the prostate enlargement, what we call, I've talked about prostatitis. The second one is the prostate enlargement, also known as benign prostatic hyperplasia or BPH. That one is very common, especially in Nigeria. Okay, if somebody has BPH, it doesn't mean that the person has prostate cancer. It's different. Okay, a patient can have an enlarged prostate without having a prostate cancer, meaning the cells are just proliferating excessively at an increased fashion. But however, they're not having cancer cells present in that cell. It just like every cell divides in the body, but some cells begin to just divide excessively, but not out of the regular pattern, which you see in cancer. So BPH can cause all these symptoms I mentioned before. Okay, the difficulty in urination, that's the major symptom. Okay, where you see someone is having BPH, difficulty in urination, they put a catheter for the patient. It doesn't mean that the patient has cancer. Okay, so but cancer is cancer as we know it. It's organized the division of cells and the formation of leather symptoms, and it leads to death if not well treated. Thank you.
Thank you very much. One last question. I have lots of questions, but we have some questions in the chat session, so I'll just quickly ask. For the three types of prostate conditions that we just talked about now, do they manifest similarly in terms of the presentation? So say somebody had an enlarged prostate and somebody's got prostatitis and somebody's got prostate cancer. Is there, or rather, are there similarities in how the symptoms will present? Or are they different?
Okay, as long as it's the prostate gland, there might be some similarities. For example, three of them might have pain on the clitoris area, because where the prostate gland is located is in between the penis and the anus. You see that soft spot there? That's where the prostate gland is. In men, they call it the G spot of men. When you touch that place, it provokes some kind of erection or sexual fantasy. Let me put it that way. Okay, so usually in those three conditions, there might be pain around that area. So that's the common symptom that they share. Okay, all right. Furthermore, there might be pain around that area. There may also be difficulty in urination for three of them. Okay, but what will differentiate one from another is, for example, somebody has fever. You can see the person is more likely to have prostatitis, okay, than a prostate cancer. Okay, let's say somebody is at a younger age, let's say 30 years old. Okay, the person is more likely to have prostatitis than prostate cancer because he's not in that peak age. Okay, for prostate cancer, there are many things we look at. There are many investigations we still carry out to further confirm which is which. Okay, so it's not just the signs and symptoms that we look at. Okay, we also do some tests as well, PSA, biopsy, rectal examination, and all that. Yeah.
Thank you. Hope, have you raised your hand? I'm not sure if it was the old one.
Yeah, I raised my hand again, just in relation to the last response to the question you asked. I was just going to ask, is there high chances that someone that has suffered, like, I don't know what the word, the prostatitis, at a younger age, is it that there's more chances that they could develop prostate cancer at an older age? Is there a relationship? Is there a link? Or is it just independent and completely different condition?
Okay, thank you very much. That was a very good question. Prostatitis is not prostate cancer, okay? And there's no clear evidence that it increases your chances of getting prostate cancer. Same thing with the BPH you mentioned, where the prostate is just large, but there's no cancer. Someone who has BPH is not even at risk of prostate cancer. They are different conditions entirely, different presentation and different prognosis as well.
Thank you.
Thank you.
Okay, thank you very much for that. We have just two last questions. I don't want this presentation to be too long. And thank you everyone for your contributions. Thank you for staying with us. So one question says, for prostate cancer not to occur in our body, I think you did touch on this earlier. What are the food that we can avoid to eat? So what are those things that we shouldn't eat? And at what age do symptoms occur in our body? I know you've touched on it, but kindly repeat, please. Thank you.
Oh, okay, thank you very much for that question. I'll just recap some of the things I mentioned. There are still research going on as to the relationship between diet and prostate cancer, but there are some things that have been mentioned or implicated in several research done. Number one on the list is red meat. Okay, it's been said that a diet that is very high in red meat, okay, like the type you see in goat meat, cow meat, and all that, those red meat can increase the risk of developing prostate cancer. So that's number one. Then two, dairy products, okay, like milk and cheese and all that, they also increase the risk of prostate cancer. I don't know the mechanism involved, okay, but it's just a causal link. Research is still ongoing, okay. Saturated fat, trans fat, the type you see in the butter, okay, the type you see in the ororo and all that, those are quite toxic, and there are diet factors that are involved. And they also mentioned, the second question was, at what age symptoms will occur in our body? Okay, I mentioned initially that one of the risk factors of prostate cancer is age. And in 99% of men, it occurs after the age of 50 years. I mean, it's quite unlikely for you to see a man less than 50 years to present with prostate cancer or to be diagnosed with prostate cancer. Okay, because it's a disease of old age. So I think that answers the question, if I'm not mistaken.
Thank you very much. And the last question says, I know, so also I have someone with prostate and others with cancer. Can you explain what are the causes in our system?
Oh, okay. Just like any cancer in the body, there's no particular cause. There's no cancer, in the body that has a particular cause. But I want to just digress a bit. Every cancer has what we call risk factors. Yeah, the risk factors are they are grouped under modifiable and non-modifiable. Okay, it's just like, for example, let's say breast cancer now. Let's use breast cancer as an example. Okay, we can say, okay, breast cancer is common between the age of, let me just say, the age of 30 to 50 years. Age can be a risk factor for that. You can say breast cancer is more common in women who saw their menses earlier, and women who stopped seeing their menses later in life. That is early menarche and late menopause. So these are also risk factors. You can also say breast cancer is more common in people who are exposed to estrogen. So let's say somebody is using a contraceptive pill. Those are risk factors. So it is so plenty. You cannot in one day say, okay, this is what causes particular cancer. It's multifactorial. Let me put it that way. Okay. In this case now we have modifiable. We also have non-modifiable. I mentioned before that the modifiable ones are the ones that you can modify, like your diet, which I just explained. What's it called now? Exercise. Okay, smoking, alcohol, sexual relations. Okay, those are under the modifiable ones. Why the non-modifiable are things that you cannot control? Whether you like it or not, you are prone to it. Like your age, if you are older, you are prone to prostate cancer. If you're a black man, you are prone to prostate cancer, unfortunately. Okay, if someone in your family has had prostate cancer in the past, you are also prone to it. You are 2 to 3 times more predisposed to this condition. So I guess that answers the question. Thank you.
Thank you very much. This is the last one now, like last. Just what's your parting message for people here? Say somebody wants to go for a screening. Is that something they can just go to their GP and say, I think I have prostate issues? We don't want to say cancer now because it might not be cancer, like you said earlier. And so can people just walk up to their GP and say, can I be tested for PSA if they have these risk factors that you just talked about, maybe genetics, age, and other stuff? Can we walk to our GP? And for people that do not have access to health and services like we do here in the UK, what is your advice for them regarding this topic?
Okay. Yeah, thank you very much. I think the essence of coming to discussions like this is that when we leave here, we have a take-home message. We should have an action point, as it were, to take home for not just ourselves, for people around us. Initially, I mentioned something we call the Informed Choice Program. Okay, that's a program where men can decide to come in and have screening done for prostate cancer, especially when they have risk factors. Okay, let's say they're around that certain age, let's say 45, 50, 55, okay, and they have probably symptoms, or probably they have relatives who had prostate cancer in the past, okay. There is always room for that. Nobody's going to chase you. Nobody's going to tell you to go back home, that you cannot have it. But the reason why I mentioned those drawbacks was that, of course, this PSA test might not give us the real picture, but however, it would give the medical practitioner more reason to investigate if the PSA is increased. And if peradventure the cancer is diagnosed using a biopsy, that might go a long way, because you know that early detection is very important for survival. So the earlier prostate cancer is nipped in the bud, the better it is for the prognosis and treatment of the patient. So of course, it's encouraged to go for screening if you want, you know, if you have any of those risk factors involved and you have any symptoms and you feel you should have the screening done, why not? Go for it. So that's my message to everyone today. Thank you.
Thank you very much. I think we'll end the program now. I just want to especially say thank you to Dr. Eweka. Thank you to everyone who's registered to be here. And thank you to those who just came as well. I do appreciate everybody. Like I said in the beginning, when you're doing a program like this and you get people actually turn up, it means a lot. Thank you. You being here means you are supporting the Divinely Classic brand. And that means that you trust us. So we do appreciate you being here for joining. And Divinely Classic, like I said earlier, we are our entrepreneurship brand. We also do health education. And the next one that we are organizing now, I still haven't gotten a date for that. We're going to be talking about cholesterol. And you know, the truth is, as we get older, we should be mindful of our bodies. You know, we should be mindful of what we are eating. And one thing I've noticed in terms of illness, in terms of management, is that management, conservative management. Now, what we are supposed to do, they are almost the same. Talking about healthy living, talking about your diet, talking about your lifestyle, talking about stopping smoking. They are very similar. We done diabetes and health education the other day. It was the same thing. Now we're talking about prostate cancer. It's the same thing. You do high blood pressure. It's the same management, or rather conservative management. So when we empower ourselves with knowledge like this, we can better manage our condition. So the next one is cholesterol. We'll be talking about. I'm still in talk with Food for Purpose. That's the charity that will be doing the program with us. And I would appreciate it if you can follow our social media handles. We are on Facebook. We are on Instagram. We are on YouTube. We share videos. And we have a website as well where we sell our products. We will be ending the discussion now. And once again, I say thank you so much, Dr. Eweka. Thank you to everyone that have joined, contributed, asked questions. You sent the link. I sincerely appreciate you, and I hope you have a good afternoon. Thank you ever so much. Thank you so much. Thank you. Have a good day.
Thank you.